Hello, today is Monday. Let's pick up on our topic of open enrollment. If you remember last week, we talked about open enrollment being from October 15th to December 7th for senior citizens. This week, we will continue our topic with Medicare Advantage plans, or MAPDs. Over the course of time, I have been in your homes during the day, and you've had the TVs on. And we have noticed celebrities advertising for Medicare Advantage plans. They advertise zero premium, zero copay, with prescription coverage, and you can get dental and vision coverage too. Well, there's some things you need to know about Medicare Advantage plans that can really affect your satisfaction or your dissatisfaction with them. So, if you're in the marketplace for a Medicare Advantage product, then you probably grew up in the 60s and 70s, and you can remember the Fram TV commercials for the oil filter. The premise went something like this: you can pay me now or pay me later. A mechanic is standing by or over an engine that is being rebuilt, and he describes that the owner didn't get timely oil changes using Fram filters. And instead of paying for an oil change with the Fram filter, he is now or she is now paying to have a rebuilt engine or a valve job done to their current engine, which can be very costly. So here's the takeaway from today's topic that I want you to understand. The Medicare Advantage plan is a legitimate product. For a basic policy, you do have the zero premium and the zero copay, and it includes prescription benefits. But when you see the celebrity advertising, it includes dental and vision, make no mistake, you have to pay extra for that dental and the vision. And the health of the eye is covered by the basic policy. So the vision is just for corrective lenses. I just said it can have a maximum out of pocket as high as $6,700 a year. And every year, make no mistake, long about the end of spring or so, people will call me up and say, how do I get off this plan? I did not understand that it has these out-of-pockets, and they're becoming a financial burden to me. Things that are included that make that out-of-pocket a factor is you can have specialist copays. You can have copays for hospitalizations and ERs. The other thing is there's percentages, percent that you might owe of a service provided. So you go and you get let's say an MRI done, and that MRI could be X amount of dollars. Well, you might owe as much as 20% of that cost for the MRI. These are things that can add up to that $6,700 out of pocket. Another thing people don't quite understand is that these Medicare Advantage plans, the base ones, for the most part that they're advertising with celebrities on TV, are HMO based. HMO stands for Health Maintenance Organization. That means they're designed to maintain your health. There are ones that have PPOs, but the PPOs are expensive, and you might find that the cost of a PPO Medicare Advantage plan is just a few dollars lower than the cost of going with the standalone drug card and a Medicare supplement. And with those plans, you have complete freedom of choice of provider, so long as that provider takes Medicare. Now, I'm not really trying to frighten you with this. The Medicare Advantage plans are a legitimate product. So let's figure out who would be a good candidate for a Medicare Advantage plan. Number one, your provider is in the network, and you have complete confidence in that provider and any facility that they would refer you to. Number two, you are looking for that premium savings afforded by a Medicare Advantage plan. Number three, you are on the healthier side and probably don't use medical services that much. Number four, you understand the expenses and the out-of-pocket. Number five, you have the financial wherewithal to cover those out-of-pocket expenses. Number six is an interesting one. You have coverage elsewhere. Typically, you're a vet and you use the VA. The zero premium or the very low premium Medicare Advantage plans gives you an option to the VA if the VA can't see you on a timely basis and you need immediate health care. And lastly, number seven, you legitimately have no other options than to take these inexpensive Medicare Advantage plans, HMO based, with higher out-of-pocket expenses. So these out-of-pockets are an issue. Remember, you will owe the provider for services provided to you. They have provided good, honest services, and they have a right to collect for those services. Forget what the politicians say. Healthcare isn't free. A politician will tell you anything they think you want to hear to get you to vote for them. But the bottom line is, providers do deserve to be paid for services provided, and you can't have that out of pocket with the Medicare Advantage plan. So, if a Medicare Advantage plan is something you are interested in, I would make the recommendation that you contact your insurance professional. That person, like myself, has an interest, a vested interest in seeing that you obtain the correct product for your personal situation. That celebrity advertising on TV doesn't personally know you, doesn't know your situation, and is probably referring you to an 800 number where you're talking to somebody who's sitting in an office many, many miles away and can't see you and doesn't have your personal interest at heart, just trying to get you to enroll in a plan. So remember, contact your insurance professional. Personally, I'll be happy to discuss your Medicare Advantage plan with you and your Medicare supplement or drug card to make sure that you're purchasing the best product for you. My number is located on the bottom of the screen. Feel free to give me a call. I look forward to hearing from you. So going forth from here, open enrollment is coming up. Let's take the time, read the brochures, understand what you're purchasing, and make wise decisions for your health insurance Medicare Advantage plans for 2021.